Hi, welcome back to my channel. So in this video, I'll be talking about the functional appliances, and I'll basically tell you all the image-based questions that can come from functional appliances. So first of all, you should know that we have rigid, flexible, and then we have hybrid, that is rigid plus functional combination. So first of all, we have the rigid functional appliances. Then we'll talk about the flexible. These are the flexible, and after that we'll talk about the hybrid. All right, now let's talk about the rigid ones first. So the primary mechanisms are that they have a telescopic mechanism. They are very rigid and permit only restricted movements. They show more skeletal orthopedic changes, and they are indicated in class 2 patients. Now these are basically non-compliance class 2 characters. Alright, now let's just go through them. So let's see the first one. I'll just lift it a little. So yeah, so see, this is our Herbst appliance, and it was given by ML Herbst. Okay, then this is the most effective fixed functional appliance. It shows the maximum skeletal change. Now this length of plunger, see, the plunger is this one and this is the tube. Okay, the length of this plunger is equal to the amount of forward position of mandible. Now let's talk about the indications. So you have indications as class 2 div 1 patient, then in adolescent patient, post-adolescent patient. Then you can also use it in mouth breathing. This you need to know because it was asked in MCQ. Then in uncooperative patients, because it is fixed, then it can also be used for correction of midline shift by using the appliance, by using unilaterally. Now the treatment effects, there you see a headgear effect. Now what you mean by that is that you see that the maxillary growth is inhibited via fixed functional appliance. Now it basically corrects the class 2 skeletal and class 2 dental malocclusion. Okay, now let's talk about the next appliance. So this was also an image-based question one. So this is the Mara appliance. Now what do you mean by Mara appliances? Mandibular anterior repositioning appliance. All right, and this is also indicated in obviously class 2. Now in this, the posture of mandible forward in class 1 to activate it. Now you have to just look for this component. In Herbst you have to look for the tube and the plunger, okay, for image based. Now let's talk about the third appliance. So give me a second. So yeah, third appliance. So this is a MPA appliance. So this is mandibular protraction appliance. So see, here you will see that we have a SS wire, and basically you have something which goes from maxillary molar and it connects to the mandibular arch wire. Alright, so it's something which is going like this and this. See again. Okay, now this is a chair side appliance. Okay, you just need to know this much about it. Now let's talk about the flexible appliances. So just write it. I'll just bring it here. Now let's talk about flexible fixed functional appliance. I should write it a little upper. Give me a second. So flexible functional appliance. Now we'll just talk about some of the important points that you should know. See, first of all, there is this intermaxillary spring design. So this intermaxillary spring design, it increases the flexibility and freedom of movement. Then there is easy to perform lateral guidance movements, but it is prone to breakage and spring fatigue. Now let's understand the appliances for image based also. Now see, this is a Jasper jumper. Okay, now here what you need to see is you have a ball pin, and basically it's attached to the maxillary molar tube. Now the length of this module is the distance between molar tube to mandibular ball plus 12 mm. Okay, now this is how it looks. You have to look for this. Alright, and getting connected. Now look at it again. Alright, now this specifically, there's a question that it follows the theory of two. So theory of two. So what is this theory? This theory is basically that the class 2 correction is through 5 components. So it is due to 20% maxillary basal restraint. Then second, it is due to 20% due to backward maxillary dento-alveolar movement. Then 20% due to forward mandibular dento-alveolar movement. Then 20% due to condylar growth stimulation, and last is 20% due to downward or forward glenoid fossa remodeling. Okay, now this is about Jasper jumper. Now let's talk about the second appliance, which is this. So this is relatively easy to like make out which one is this. So this is a churro jumper. So basically there's a cinnamon roll, and it basically takes its name from there because you can see the number of coils in it. And alright, so this has like, see this, so it has 15 to 20 concentric circles, alright, wrapped around. And then the last one which you should know is this. Now what is this? This is a clapper spring. So this is a from the maxillary molar to the mandibular canine. Now let's talk about hybrid appliances. So we can talk about them relatively here. So I'll just we'll use this. So hybrid appliances. This hybrid appliances, so basically they are a combination of the rigid and the flexible. So the coil springs are present and they basically apply elastic forces, so continuously apply elastic forces 24 hours a day, and there is decrease in bulk and increase in patient comfort. It basically imitates class 2 elastics action. So let's just go through them quickly. So this, yeah. Yep. So let's talk about the first one. So this is the forces FRD. So FRD is fatigue resistant device. Now here again you will see that this is a coaxial spring design and it has 5 lakh cycles of loading. Okay, and it's from maxillary molar to the mandibular canine. Then this one is relatively easier to make out and it is Sabag universal loop. So basically it has an omega loop. Fine. Then this one was asked once, so you should know this is a Eureka spring. Alright, now in this, if this has, yeah, so in this, if you see, this is our guide tube, this component is eye, and this is the telescopic. This one is, which is power scope. So basically it is just a wire to wire design. It has an 18 mm telescopic mechanism and it also has night eye spring. You just have to see where they have telescopic. See, you will be able to understand them because like sometimes now they put the appliances and they ask which is just rigid, fixed and functional. So anything which has a telescopic mechanism incorporated into it and it seems as fixed, so this is the telescopic mechanism. Then over here also this is the telescopic mechanism. Alright, this also has the telescopic mechanism and it is fixed. Alright, so this completes the functional appliances, and if you found the video helpful, do give it a like. And plus there were 2 more things which I forgot to add. I'll just add them now. Just give me a second. So if I'm able to find, I'll add it. Yeah, so I'll just add it here. Yeah, so these are 2 things that you should know, like they can be asked. I'll just, so this is a different category. Now these are the fixed functional appliances acting as substitute to elastics. So this is the SAF spring. Now what does SAF stand for? It stands for the severable adjustable intermaxillary force. So this is the thing that you should know for image based question. And Alpern's class 2 corrector, so you can see the hooks, right? Let's just see what they've written about it. So large forces generated may have accounted for rapid correction observed. Armstrong, and it has two nitre coil springs, one inside and one is holded on the loops on both the ends. Class 2 and class 3 correction. It functions the same way as elastic, similarly fixed to the lower molar and upper bicuspid. Telescopic action. Alright, so this is about all the fixed functional appliances: rigid, fixed, rigid, flexible, and hybrid. So if you found this video helpful, do give it a like, share, subscribe.